Planned strike, which would have seen nurses at 8 hospitals across New South Wales walk off the job, has been cancelled by the Fair Work Commission just hours before it was due to start. Reporter Miles Holbrook-Walk joins us now with the details. Miles, good morning. What did the Fair Work Commission order?
Well, Mel, the Fair Work Commission was responding to a late legal bid made by Healthscope, who is the second largest private health provider at hospitals right across Australia, and made this injunction to the Fair Work Commission essentially under a piece of legislation known as Section 424, which deals directly with threats to either public safety or the economy. Now, obviously, in this instance with a hospital, it's perhaps not surprising that their concerns were around public health, and indeed a birthing suite at Newcastle private hospital specifically, saying that they had concerns around staffing levels and that they were not going to be appropriately managed, even when factoring in that life-preserving care was still going to be guaranteed by nurses at all of these 8 facilities right around New South Wales, and most of them are in Sydney, but 2 are in the Hunter Valley, one at Newcastle and the other one at Hunter Valley Private Hospital. Obviously, none of these actions now going ahead when the order was made at about 11:20 p.m. last night from the Fair Work Commission, and we had a bizarre scene almost this morning where you actually had some nurses already at the Northern Beaches Private Hospital ready to take a walk off in this 26-hour strike, and then being promptly informed that actually it wasn't going to be able to go ahead. And just because it dealt with the birthing suite at Newcastle Private Hospital, some people might be wondering why it extends beyond further, and essentially it's because that action was covered under one protected industrial action. So when that is suspended, all other protected industrial action therefore becomes illegal, meaning none of the other walk-offs can take place legally, Mel.
So Miles, have we heard from the nurses who are planning to strike?
We've heard actually from the leadership of the Nurses and Midwives Association in New South Wales, and they've reiterated that these actions are all about drawing attention to the plight of nurses working for Healthscope as they see it. So they point to the difference in pay conditions state to state. In Queensland, nurses working for Healthscope in some instances are paid 16% more. Nurses here in New South Wales are looking for a 15% pay increase, changes to staff ratios, and that staff ratios is something Michael Thwaites from the Nurses and Midwives Union spoke about this morning.
We know that the staffing levels across many Healthscope facilities are below that of the public sector. And whilst we see the public sector moving towards nurse-to-patient ratios, Healthscope maintains that its current staffing levels are adequate. Our members say it doesn't meet the evidence-based best practice that we know should be implemented.
So that's Michael Thwaites there from the Nurses and Midwives Association of New South Wales. Now, worth noting too here, Healthscope has confirmed as much that they applied for this action and were successful, obviously, now we know, in their Fair Work Commission bid. Of course, this doesn't mean the end of the dispute, though. The suspension only lasts for the 26 hours it covers. Whether or not nurses then resolve to try and find another moment to strike and do a walk-off of 26 hours, that remains to be seen. It could be so much so that they do it with a caveat of not taking this action at a birthing suite, for example, and perhaps that would convince the Fair Work Commission that the action wouldn't be in breach of that legislation, Section 424 of their Fair Work Commission Act, Mel.